are there. The first lead paper is the recent and future trends of robotic surgery in the companion practice. As you all are aware, the theme of the current symposium is to find some new innovations. And as you are aware again, the surgery goes by mechanical, manual, and the latest would be the keyhole surgery. The employing the robotic system is one new innovation which is already in vogue or utility in the human surgery, and of course in the veterinary surgery also it is coming up, because most of the standardizations are done in the animal model, and although it is in infancy, in years to come or decades to come, the robotic surgery will become a reality. The definition of the robot, because robot applies in all aspects, not necessarily in the operation theatre, in many mechanical places also it is being used. So it is stated that it is a manipulator or it is designed where it can be used for the multiple options or multiple purposes. Robotic surgery is also called as the robotic assisted surgery. In short form, it is called the RAS. So, a main advantage of this RAS is to go for the minimal invasiveness. So, what we talk of minimal invasiveness, the size of the incision or the procedure, the time taken for the recovery, convalescence, all that will get shortlisted, and that's the main advantage of the use of robots. But definitely, no robots can perform the surgery. Always these robots are operated or handled under the control of the surgeon only. And there are various systems of the robots that can be adapted both in the human as well as the animal surgery. The one would be the passive role. Passive role means they are used for the passive purposes or the tool holder, and they have a low risk but not of much utility. And the second one be the restricted role type of robot. Definitely they are used for more invasive procedures, but higher risk will be there when you are handling them. One has to be very cautious. And the third one is the active type of robot. They are with high responsibility and also high risk. They are used day to day.
Dr. Ramana, yeah, please, yeah. I will take the introduction because those who are going to present, most of it they have not yet submitted or uploaded their program in computer. We are again requesting you, those who are interested to present the papers or lead papers, whatever may be, please upload the computer, your matters in the computer in the control room, so that we can run the program in right time and very efficiently. Thank you. Please, Dr. Ramana.
Thank you so much. So the various types of the robotic systems which are available are used as of present today. One would be the CT scan. So here it works with the CT scanner, taking the multiple images, and again it is completely autonomous type of robotic system. The second one is the cyberknife. So it is used for the radiation therapy of any internal tumors or the cancer, and here it is able to deliver the radiation therapy very accurately, and also it will minimize the dose of the radiation also. The third one is the automated endoscopic system for optimal positioning. So this type of robots will go with the endoscope. So they will be having a constant touch with the mucous membrane, and generally they are aligned with the endoscope. Generally they are more used for the imaging purpose, maybe the mucosa or any structure internally or intraluminally, and they are less invasive. This one more type of the robot design is called robot arm. It is used in case of orthopedic procedures, especially for milling the bone, especially for conditions like hip arthroplasty, where we can mill the cavity, maybe acetabulum or the femoral end, etc., and they are beneficial. One is the active constraint robotic system. In form it's called Acrobat. Again, it is used in orthopedic procedures in case of the arthroplasty, and it will give accurate preoperative images, and also unlike the conventional drilling, it will not allow the excessive bone damage or injuries to the bone also. Neuromat is one more type. This will guide us for the accurate landmarking of the anatomical structures, thereby preventing the damage, and also it helps in the precise positioning of the surgical instruments, and also it will help in proper placement of the drill or the probe or electrode and other things. And it has got a moderate level of autonomy when it is working. This use is used in both laparoscopy and thoracoscopic surgical procedures, and it has got a voice control, and also have both the right and left maneuverability of the laparoscopic instrument, and it can be used or it can be moved both vertically as well as horizontally during the procedures. Demency robot, this is the most used or most commonly employed type of robot. It has got multiple functions and multiple characteristics are there. Here it is a teleoperated system. The surgeon will be sitting outside the operation theatre with a console, and this robot will work independently. But independent work is always under the control of the surgeon, where it is also called as the master-slave manipulator. The surgeon will be the master and the robot will be working like a slave, and you will get the best results in this. This is the surgeon console, patient side card, and also vision card. And the other advantage, when the surgeon is watching the console, you will get a highly magnified images to the extent of 10 times, and also even you can control both the fingertip controls will be there. And the most important, when you are using this type of robotic system, whatever the hand tremors generally we see, because that can always cause damages or injuries to the internal organ, is taken care of, and it will abolish that the hand tremor, the action, or otherwise it will work like a filter. And again, in the surgeon console, you will have a control of the foot control also, and the fuel control switches are also there, and even it can work as a training asset for the robotic surgeries. And the patient side, the most important, it will have 4 active arms. The robot will have 4 arms, and it can bring about 7 degrees of movement or the actions. That will make the procedure easy, because in general laparoscopic it is said 4 type of movement, but in case of robotic you can go for the 7 degrees of freedom, or the movement will be there. And for the vision card, it is a storage, and it will allow the watching of the procedure also, and the multi-image display will be there. The advantages of robotic surgery, as all of us know, when we take up the keyhole surgery, the advantage is the smaller sized wounds or the incisions will be there, and we can reduce the bleeding because of precise incision. The damages to the vascular structure also is limited, and the patient can be discharged very early. Scar is also less, and of course you have to take the cosmetic also into account, especially on a visible part or the visible side. And overall, it will give a much better visualization of the internal organs to the surgeon, unlike the conventional surgery where we make incision and we fail to recognize the organ, and sometimes blind way we'll handle the organ, or we pull it out, we operate another thing. Such things are not there, and again you will get an image which is almost 10 times or 10x magnified images will be available to the surgeon. Why this robotic assisted surgery is superior? One will be it will increase the dexterity, and it will provide, as already told you, unlike the laparoscopy, it will give you a 7 degrees of motion. and it will eliminate the possible physiological tremors or the movement of the fingers or hand during the procedure, which sometimes can be disastrous or causing injuries to the vascular structures, and also it can scale the movements also. And there is a good coordination using this. The good coordination comes between the working hands and also the eye, and we can overcome that fulcrum effect. What the fulcrum effect, sometimes even the best of the best surgeon also we have faced it. Sometimes unintentionally, because of this fulcrum effect, the injuries can happen to the unintended structure can be eliminated. And it will also provide the ergonomic position, what we generally employ in the laparoscopy, wherein whatever the degrees 30, 40 is ergonomic position. So this will also provide that, and the surgeon can work sitting in a place and using the ergonomic position and overcome the whatever possible fatigue, especially in case of long-standing procedures or operations. And as I already told you, the improved visualization will be there, and you will get a 3D views, and also the depth of the organ can be easily assessed, and the best of the best will be the magnified images. Even these robotic surgeries are most beneficial, even in some high risk procedures, what we call it as the vascular surgery or the microanastomosis also, or vascular anastomosis also, it can be used very effectively because of the advantages of higher magnification, maneuverability, and increased resolution. Will get the best results even in the possible the anastomosis, like replacement of the kidney or the transplant or so many other procedures. The other advantage is the telesurgery. Sometimes surgeon sitting away, not necessarily in the same place, away also, using the satellite or other means also, he can guide the robotic procedures, and he can yield also. And in September 2001, a transatlantic gallbladder operation was performed, where the surgeon was sitting in the New York and the operated patient was in the Skuast-K. Of course, the robotic assisted surgeries, definitely, as it stands today, the few demerits or disadvantages are there, because it's a new technology, needs lot of the usage, and the efficacy has to be established. And as it stands now, we do not have much long-term results, or the study results are not there. And again, we have to work more. The what you call it as wet labs has to be conducted, where many procedures has to be redesigned and standardized before being applied in the animal practice. And the other possible demerits would be the cost of the equipment, and sometimes the Devancy surgical system, as it states, is about $1 to $2.1 million. So that could also be one demerit using them in the conventional practice. Other disadvantages, it's a cumbersome robotic arm, as I told you, because of the 7-degree movement, and lot of footprints will be there. And of course, as it stands today, the availability of the compatible the instruments which has to be used along with this robotic system are not many are available. But definitely that should not be a discouraging one. But with the improvement in the technologies or availability of the technologies, definitely the years to come, we can always go with the suitable instrument which are compatible, and definitely it will add to the success rate of the RAS. The areas where it is possibly being used in human and sometimes in the animal models includes the neurological, the urological surgery, gynecological, cardiothoracic, gastrointestinal, and also in the general surgery. Of all this, the highest application is reported in urological and gynecological systems or affections. The one common procedure is the robotic assisted the prostatectomy. So with minimal invasiveness and best results have been commonly being performed, and sometimes even for the procedures on the renal system, especially on the kidney and the urinary bladder also, it is being tried. And even in sometimes for partial nephrectomy and also the pyeloplasty, and sometimes the robot assisted radical cystectomy, whenever the bladder tumors are there, when part of the bladder is to be excised, with minimal invasiveness and less damages, it has been accomplished. One report, a robot-assisted radical prostatectomy in a client-owned dog with prostatic adenocarcinoma. It is a about 6-year-old Burmese mountain dog weighing about 55 kgs. It was diagnosed on the CT having a prostate tumor, and animal had the hematochezia and tenesmus complaint. And upon this, it was diagnosed as the prostate enlargement. Using this robotic assisted procedure, a radical prostatectomy was produced or made one, and the animal could recover within 7 days, and catheter was removed by that time. So it was very accurate, less invasive, and naturally the outcome of the results will be rapid and complications were also less. And even for the placement of the neurosurgical instruments also, sometimes this robotic system is being used. For the various models are available, like ROSA 1 for the spine and brain, and similarly CERF for the brain lab. And again, one more robot assisted procedure in the animal, that was in a swine model which had a lumbar vertebral injury, where discectomy was done and the fusion was brought about, and even it yielded a rapid result, and the time of convalescence also was very short. And sometimes in orthopedic surgeries also for reconstruction of the joints, especially the knee joints, where because of osteoarthritis, or sometimes in the hip joints also, the consequent to conditions like hip dysplasia among the dogs, so it needs reconstruction, or endoprosthesis also. So this is being used, especially for the guiding the oscillating scissor or the milling machine. And the most advantage is that manually when you go for this milling, sometimes the extra or unwanted damage could be there, but in robot it is very specific and injuries are very, very less. Joint reconstruction, as already told you, for endoprosthesis, and various types of the devices are available which will go with the orthopedic system. And a comparison study was done both using the manual model as well as the robotic assisted for the conditions for the hip replacement, wherein the patients had the osteoarthritis, and it was done in about 20 male greyhounds. One was the hand broaching group, another was the robot assisted group. In the hand broaching group, the damages were more, and post-operatively few of the dogs suffered the fracture of the femur. Whereas in case of robot assisted, there was all the patients and all the animals were successfully operated, and the mean time was 29 minutes longer, but the end results were so good, the gait analysis was excellent, and it was better compared to the manual group or the hand broaching group. Even in case of the radiation therapy, addressing to the tumors also, the robots have been employed or been used, what we call it as robotic radiation surgery, wherein which you can deliver the particular radiation or the radiation therapy accurately. This is how it is being used, the system. A cyber knife has been used, that is a part of the robotic system for addressing the intracranial tumors. Whenever the intracranial tumors are there, the approach or the procedures are so invasive, and sometimes the damages could be uncontrollable. But employing this in a few, about 59 dogs which had the primary intracranial tumor were considered, and about 700 to 800 gray dose of 3 equal doses were employed. And conclusion was that the mean survival time of the patients which underwent the robotic radiation therapy was much longer compared to the conventional procedures. Even for the equines, a special the robotic assisted equipments or the designs are available. So it is a robotic controlled imaging system, wherein which without sedating or without bringing the animal to the recumbency, in the standing position only, so many imaging, especially addressing to the lameness problem, this can be employed, and again it has found to provide a better increased diagnostic results or the capability. So it will help in whole body scanning, and patient need not be sedated, or it can go with the standing and there will be no motion, and you will get a 4-dimensional images also, and we can get any amount of magnification or zooming of the image for very accurate radiological or the imaging interpretation. The future of the robotic surgery, especially in the animal practice or veterinary medicine, one is the requirement of the improved instrument which are compatible with the robotic system, what we call it as miniatured robotic instrument, which are smaller in size but they should have a good ability, stiff manipulation force and also motion capability, and definitely the science will improve and this type of instruments can be designed. And similarly, it can be used for targeted drug delivery, surgical operation, even in the disease diagnosis also. Apart from that, even for the drug delivery, sometimes directly you can deposit the pharmaceutical or the drug into the lesion, so you need not have to rely upon the blood circulation or the blood supply. And the less invasive or minimal invasive, as already told you, so even for the natural RFIs or transluminal or endoluminal or endoscopic procedure also, it can be applied. It could be otolaryngal procedures or even in the colorectal procedure, it has been effectively used. Semi-autonomous assistant functions also being designed. These are working haptically. They will guide the surgeon on the resection line, and also they will prevent the unintended injury during a conventional or a manual procedure. Multimodal sensory feedback are also available. Again, they will compensate for the surgeon finger trip, what is being used in the open surgery, and they will use the miniature sensors and for ending good end results. The novel imaging or augmented this thing, in this advanced imaging and machine learning methods are there. So we have to take, they will provide the relevant preoperative data about the anatomical structures, and that will help in the proper guiding of the surgeon and also proper placement of the robotic instrument during the procedures. The one more is the robotic prosthetic limb. Many times when the pet or the companion animal undergoes the amputation, so there are no ends. Of course, some places the artificial limb is available, but artificial limb is numb because it's not able to flex or move it. This is one area where they are considering the robotic prosthetic limb. It will be able to execute many of the complex movement of like a normal limb, and also it will harness some of the electromyographic activities also. So this is one area where a lot of interest has been shown, and maybe it will be a useful one in the science also. Conclusion: robotic surgery, as already told you, it is being used in the humans in coupling with the laparoscopic system, and in animal models, of course, although very few cases of robotic surgeries have been reported, one good line is that all these robotic surgery have to be standardized in the animal model, and that will give a lot of scope for the research and the science, and that can become a baseline for expanding the robotic surgical technique or the robotic assisted surgical technique among the animals. And only thing, as already told you, one would be the cost of the equipment and cost of the instrument, and designing the instruments are need to be done. But with the lot of tests and also the wet model are using the live animals for the experimental or training purpose, definitely we can come with very good end results, which will be beneficial in going for a applicable robotic surgery in animal practice. And of course, as already told you, veterinarians are already collaborating with the human side, and whatever the results that are available is always beneficial to the veterinary surgery. So with this, I'll end my talk. Thank you very much.
Thank you. Professor A. Rangana is a very senior faculty, and since many years he is presenting his lead papers, which is very interesting topics. And in this session also he has presented very nice topics, very elaborately discussed in length and breadth, which has given a new idea regarding use of the robotic surgery. Though robotic surgery even in the human practice is also very much in intensity, but this is of course the demand of the day. In coming days, this will be the challenging topics, and maybe veterinarians also will be engaging themselves using this robotic surgery. And to continue this session in right time, I will request all the delegates, if they have any sorts of questions that can be raised, those can be discussed with Dr. Ranganath during the entire daytime. Thank you, Dr. Ranganath, please.
I would request Balachandra sir, if he can provide a moment to Ranganath sir, please sir. Thank you so much, Balachandra sir. Now we have one more lead paper that will be presented by the Bakri officers. In fact, it is the cutting edge implant technologies in osteosynthesis, advancements in biomechanics and strategies.
Thank you. Right at this point, I will hand over this mic to Dr. Professor Ranganath as a chairman of this session. Good morning. Respected chairman of the session, reporters, distinguished delegates, ladies and gentlemen. Today I am to present a paper on the novel and futuristic implant for osteosynthesis, biomechanics and strategies. To be very honest to say, that the movement is alive, and improve the quality of the movement and you improve the quality of the life itself. And that is very, very applicable in case of animal being also. Unless and until the animals are movable in the right form, their utility, their ability and their functionality is always compromised. And keeping in this view, how this movement of this animal or individual can be increased, how this strategy in future strategic way that can be properly functionalized, that is the target of this presentation of this paper. Thank you. As per the Global Burden and Bone Fracture Report 2021 in the Lancet, and it was in nearly 204 countries data of from 1990 to 2019, it was projected that and statistics was published, and there it was focused that 178 million new fracture incidents took place, and out of this 455 million of prevalent cases are always existing there, and 25.8 million here lives with the disabilities that individuals generally have living structure. As a result of which, based on these statistics, the incidence of fracture is likely to increase in the next few decades, and it has been projected that in 2025, nearly 13.5 million fragility fractures will be there, and nearly 500 million people will be surviving with the osteoporosis. Of course, in such a comprehensive data, though it is not available in case of animal population, but it is estimated that is, of course data may be equal to that of human populations. And keeping in view these statistics, now obviously the question comes how these large numbers of this fragility, morbidity related to orthopedics problems, how it can be countered, it can be challenged by the surgeons as well as the veterinarians. And in search of these things, in keeping in view the problem, the futuristic attempts and what should the strategies for the novel bioimplants that should be, fabricated so that this problem can be encountered. And as a result of which we know this mechanism of the biomechanics and osteosynthesis, from the biological point of view, bone healing is a complex process, and it starts from the onset. Cortical bone has some specific mechanical properties, cancellous bone has different, very specific properties of the physical properties. And keeping in